A very good morning and a very good day I wish to all of you. Welcome to our forum this week. It was a great day today to discuss and debate. Nowadays, many a disease and healthy problem have happened around us. Besides, there are so many opinions on how to prevent or protect our environment from this problem. As well we know, healthcare and antibiotic is the current big issues, which is enable you to think about this topic that we has been highlighted and we are trying to solve issues together by sharing the beneficial and interesting idea and thought which will be delivered by our panelists today. Today, we would like to highlight a topic that is quite interesting to be discussed, the pros and cons of modern healthcare and antibiotic. I am sure one of us have our own opinions and thoughts on this topic. Before we proceed to our forum, I would like to introduce our panelists today. There is Siti Nur Alfiah binti Basri as our panel 1, followed with our panel 2 Siti Izzatu Mariam binti Nasir, panel 3 Suhaila, and lastly our panel 4 is Siti Razifah binti Majani. How are you guys today?
I'm fine, thank you.
Alright,
Fine,
thank you. Alright, thank you for all your response. Before we start our forum in detail, let me explain our topic for today. Modern healthcare is considered equivalent for the technological advancement according to the revolution of the sophistications, respond to the changes by developing strategy to provide the best patient care remaining profitable. Technology is being used to provide a better patient experience or the run a more efficient practice in modern healthcare. Meanwhile, antibiotics are the powerful medicines that fight certain infections that can save life when using them properly. They later stop bacteria reproducing or destroy them. The immune system usually kills bacteria before they grow and produce system. When the white blood cell WBC destroy the harmful germs, even if the symptoms are fewer, the immune system is typically able to manage and to fight off the illness. Modern antibiotics were in the prescriptions. There are pros and cons to the healthy care and antibiotics. Without wasting the time, let's hear from our opinion from the panel 1, Miss Afia.
Thank you, Miss Moderator. Right, first of all, my main point is I want to emphasize that healthcare can help people live longer lives. As we all know, life expectancy is determined by various factors, including genetics, hygiene, lifestyle, and crime rate. Still, health and easy access to healthcare can also be influenced. People who care about how they live and how healthy they are live longer and contribute to the population. For example, we can see that Japan and China have large population because the people there prioritize healthcare. Furthermore, healthcare can help to maintain mental health and reduce stress. A healthy lifestyle is also essential for keeping your mental health and controlling or reducing stress. For example, getting enough rest and sleep can calm your body and mind and make you feel less stressed. With this, healthcare can see that it's does good and it's very important for our health. Thank you.
Thank you so much for your point given just now. Based on the point that panel 1 just mentioned just now is quite interesting. What I like about the point that just stated just now is about the healthy care can help to maintain mental health and reduce stress. Maintaining mental health and controlling and minimizing stress require a healthy lifestyle. Getting enough rest and sleep, for example, can help your body and makes it relax and feel less stress. As the result, healthy care can demonstrate its beneficial to our healthy. So, without wasting time, we move forward while listening to the opinion from the panel too. Miss Izato, what is your opinion regarding our topic?
Thank you, Miss Moderator. I agree with the answer and view of panel 1, as well as the advantage of antibiotic. Antibiotics have the advantage of being proven to be effective in fighting bacteria and virus in the body that can cause a person illness such as fever, cold, and cough. Antibiotic will paralyze the bacteria or virus that are in our body from continuing to spread. Therefore, antibiotic can help patients to reduce their pain symptom by simply taking antibiotic. This also means that antibiotic can help the immune agent in our body to fight virus and bacterial infection that occur in our body. Antibiotics are also very efficient medicine to have a positive effect on patients. Based on research, antibiotics can reduce bacterial and virus infection in 24 hours to 48 hours or even faster. Among the significant advantages of antibiotics is that antibiotics are very easy to consume and to use for patients. Patients can take antibiotic orally because on average antibiotic are medicine that is used orally. Thank you.
Thank you so much for your great point of view about the pros of the antibiotic that has been stated by the panel 2 just now. As we all know that antibiotic has been proven to be effective in fighting bacteria and virus in our body. Well, now we proceed to panel 3. What is your point of view about what has been mentioned by the panel 2 just now?
Thank you, Ms. Moderator, for your question just now. Based on my opinion, there are pros about the healthcare and antibiotic that had been stated by panel 1 and panel 2 just now. But here I would like to state my opinion regarding the cons of healthcare, such as taking insurance. During the waiting period, you must wait for a certain period before you can make a claim, but you cannot claim some all of the health insurance benefits from your company. An initial waiting period or a 30 days waiting period is the time during which a customer has to wait before claiming her health insurance policy. Any accident-related claims are exempt from this waiting period rule. This also aids to prefer from taking out health insurance only in times of illness. The premium of your health insurance policy mostly depends on your age. There is a significant difference in the number of premium when you buy a health policy when you are 30 years old and when you buy a policy after crossing 50 years. Insurers get increased price by charging highest premium. That's all from me. Thank you.
Thank you so much for your point of view just now. Based on what have been stated just now, you must wait for the set amount of time during the waiting period before the filing a claim. However, you will not able to collect all of your company health insurance benefit. The time a customer must wait before the claiming a healthy insurance policy is not an initial waiting period for 30 days waiting periods. This waiting period restrictions do not apply any accident-related claim. Alright, now we move on to the panel 4. Mr. Siti, what is your opinion about this topic?
Thank you, Ms. Moderator. After the opinion of the three panel we discussed a moment ago, we can find out about the various pros and cons of modern healthcare that we do not know much about, and the matter is also given less attention than the use of antibiotic. Here I would like to enlighten the use of antibiotic in human life. There are also less desirable effects when taking antibiotic capsule. Antibiotic can cause allergic reaction. This allergic can range from mild effects such as urticaria, a rash all over the body, to severe such as skin burn and shortness of breath. In addition, antibiotics have undesirable consequences as antibiotics can produce mild side effects such as nausea, dizziness, vomiting, and diarrhea, as well as serious ones such as kidney, intestinal, and liver damage. Stevens-Johnson syndrome is a disease that is a possible adverse effect of some sulfa-based drug that is a type of antibiotic that has been introduced. It also causes skin disease including burn and target the lips, eye, and tongue. These adverse effects are potentially fatal despite the use of antibiotic and easy to treat real and virus disease. Fever can also occur due to antibiotic intake. Many are unaware that antibiotics can cause fever symptoms, especially if they are given intravenously. Intravenous is an effective and perfect way to supply fluid and electrolytes directly into the body through injection in the hand or arm according to the patient needs. I think this antibiotic is not the best way to relieve the disease in the long run, although its use is relatively simple like swallowing capsule or by injection. Thank you.
Thank you, Fanafo, for your point of view just now. Here, what I can conclude all the points given by all of you, which mean that all the various pros and cons of the modern health care that we do not know much about it. And the matter is also given less attention that use of antibiotic. Right. Now my question is regarding the cost between the healthy care and the antibiotic. Is there any difference between these two things that the other people might did not know about it? Any one of you can answer my question.
Excuse me, may I answer it?
Absolutely.
Thank you, Miss Moderator. Right, for my opinion regarding this question just now is there are difference between healthcare and antibiotics. Fortunately, the solutions are low cost and not difficult if only the healthcare system accepts its duty of care to alleviate suffering. This mandates healthcare professionals to learn to treat pain and suffering as their disease. Once the healthcare system accepts this responsibility and overcome needless regulatory and procedural barriers to access essential medicines, then the solution is easy. Healthcare changed dramatically because of technological developments from anesthetics and antibiotics to magnetic resonance in imaging scanners and radiotherapy. For sure, technological innovation is going to keep transforming healthcare while technologies that provide and create new drugs and treatments, new devices, new social media support for healthcare and each other will drive innovation and human factor will remain one of the stable limitations of breakthrough. Although the medical culture is similar, there have been dramatic technology change. Thank you.
Alright, thank you for your points just now. Nevertheless, low cost and the simple alternative exists in the healthcare system embraced in the responsibility to relieve pain. From the anesthetics and antibiotic to magnetic resonance imaging, scanner, and radiotherapy, technological advancements have drastically altered healthcare. Future technological environment will continue to transform healthcare. With technologies that provide and create new drugs of treatments, new devices, and new social media support of the healthcare, among other things driving innovations and human factor remaining one of the stable limitations of the breakthrough. In my conclusions, modern medicine have been kept more of our healthy, but modern medicine have been unable to dispute the negative effect of the modern healthcare. Thank you so much for listening our group till the end. Now we open the question and answer sessions. Thank you.